In regards to cervical cancer in particular, greater than 90% of cervical cancer are caused directly by HPV infection. The vaccination can prevent a large percentage of cervical cancer diagnoses each year in the United States. The CDC recommends the HPV vaccine to be given at adolescent age, between the ages of 11 and 12 years old. So that's a lot younger than the typical patient that I encounter. It was introduced in 2006, but the uptake of the vaccine has been relatively low, especially in Bexar County. I perform counseling on contraception, what birth control are they currently using, or questions that they have regarding different options. I make sure they understand what HPV is and what the vaccine covers, because that's really important. But I also talk about cancer prevention, and I think that's something that patients and parents can understand a little bit better. A concern that patients have is that we've done their screening and they have an HPV positive test, but they're still in the window where vaccination can occur. I still recommend the vaccine. There's over 150 strains of HPV. About 40 of those strains affect the lower genital tract. But we know of 7 that are included in the Gardasil vaccine that are highly oncogenic, which mean cancer-causing. 2 in particular, 16 and 18 strains, are the most oncogenic, causing more than 75% of the cancer-related HPV infections. And so vaccination prevents further infection of different strains of HPV.